Hi, I'm a senior scientist at the Virginia Department of General Services Division of Consolidated Laboratory Services, or DCLS for short. Our lab plays a vital role in Virginia's public health and environmental safety. Today we're going to demonstrate how to correctly submit a COVID-19 sample to DCLS. A DCLS COVID-19 collection kit includes a biohazard bag with an absorbent pad, a tube of viral transport media, or VTM, one sterile swab, and one DCLS COVID-19 submission form. The most current version of this form can be found on the DCLS website. Let's take a closer look at the submission form. There are a few specific fields that are required to process a sample at DCLS. Last name, first name, birth date, submitting facility, date collected, time of collection, and specimen source. In the patient information section, the following fields are required. Patient's last name, include a suffix if applicable, first name, date of birth with 2-digit month, 2-digit day, and 4-digit year. Complete remaining information as applicable. Moving on to the submitter information section. The submitting facility is who will receive the results. Remember, these are health records and must go to an authorized provider. Include the submitter address and phone number. The public health contact should be the person who can answer questions about this sample. The next section is for patient medical history. The disease suspected is pre-filled with COVID-19. Complete any other applicable information. Now let's look at the outbreak information section. If applicable, the Virginia Department of Health, or VDH, will assign a site-specific outbreak code that will be entered here. If the collection location is different than the submitting facility, you can document that here. Moving on to the specimen collection information, the following are required fields: date collected, time of collection, complete and military time, and specimen source. At the bottom of the form, there is an additional information section. Only complete this section if it is necessary to provide details not already listed on the form. Please do not use the lab use only box. The DCLS collection kit contains a tube of viral transport media, or VTM, and a synthetic tipped swab with a plastic applicator. Please check expiration dates prior to use. If using a pre-printed patient label, place the label along the length of the tube. If handwriting the name and date of birth, please print legibly. Verify that the name and date of birth on the label matches the submission form exactly. This includes spelling, name order, and suffixes. Any discrepancy will delay testing and potentially end in rejection. Samples received with blank labels will not be tested. Once the patient's swab is collected, place the swab in the viral transport media. Snap the swab at the break line and securely place the top back on the VTM container. Please check that the sample is closed properly. If it leaks during transit, it may be rejected. Most biohazard bags have 2 compartments. Place the specimen in the main compartment that closes. Close or seal the bag. Fold the submission form and place in the outer pouch. Do not put the form in the same pouch as the sample. Once the collection is complete, the specimen should be stored at 2 to 8 degrees Celsius if not shipped immediately. Now the sample is ready to be packaged for shipping. Samples must be shipped on cold packs and received within 72 hours of collection. Please do not use ice as it melts and leaks. Close the shipping container. If using an insulated shipper, it must be taped shut. Transportation to the lab can take place through your routine DCLS courier service if applicable. If your location does not have a routine DCLS courier, contact your local health department or use a commercial carrier. Specimens submitted through commercial carriers, such as UPS or FedEx, must be packaged in accordance with proper shipping guidelines for dangerous goods. Call DCLS at 804-648-4480, extension 104, to request kits and shipping materials. Thank you for watching this video. If you have any questions, please contact us at the number on the screen.